If you're a man over 60 and you can't remember the last time you woke up with morning wood, this video is for you. This isn't about pills. It's not about supplements. It's one 5-minute habit you can do in bed tonight. Later, I'll show the exact routine. But first, why it matters more than you think. What most men miss is not the medicine. It's the muscle. If you ignore this, things change slowly at first, then faster than you expect. You may notice weaker erections. You may feel less sexual confidence. You may wake up to more nighttime bathroom trips. Over years, small muscle weakness can lead to real losses in bladder control and prostate recovery. It can make you feel older faster than your calendar shows. Left unchecked, that small loss becomes a kind of permanent decline. Erections depend on 3 things: blood flow, nerves, and a small group of muscles at the base of the pelvis. Those muscles control the plumbing. If they weaken, the plumbing leaks. If you think this is only about sex, think again. This muscle affects bladder control and prostate recovery too. Stay with me. I'll tie this to a real clinical study shortly. There is a simple thing you can do before bed that helps all of this. Do 5 minutes of pelvic floor training each night. It's quick. It doesn't require pills or special equipment. But here's the subtle catch: timing and technique matter. Do it the right way and the right time, and it may accelerate the return of morning erections and improve control. Do it badly, and you get little benefit. I'll walk you through the exact moves, step by step. First, you need to understand why they work. Think of the pelvic floor like a hammock of muscles under your pelvis. It lifts, supports, and squeezes. When these muscles are strong, blood stays in the penis during sleep. That creates morning erections. When they're weak, blood can leak out more easily. Clinical trials and urology clinics have shown pelvic floor training can improve erectile function. Doctors have been recommending pelvic floor work for men for years. Most men never train these muscles because they don't know they exist. But use them every time you stop peeing midstream. That simple test is your clue. Understanding this makes the exercise less strange. It also makes it effective. Sleep plays a huge role too. Sleep is when testosterone peaks and the body repairs itself. Nighttime erections are normal and healthy. Doing a short muscle routine right before sleep primes those muscles. That helps them engage more during the night. Small studies and clinicians report better nocturnal tumescence when pelvic muscles are active and toned. It's not magic. It's timing. You wouldn't lift weights and then never rest. This is the same idea, just 5 minutes at night. The when is important. Do it before you fall asleep, not in the middle of the day when you're distracted. Breathing, posture, and relaxation change the results more than most men expect. Breathing correctly keeps your belly relaxed so the right muscles do the work. If you hold your breath, you recruit the wrong muscles. Lying down is the easiest starting position. It keeps the rest of your body calm. Do not tighten your butt, squeeze your thighs, or clench your stomach. Those are the usual mistakes. The difference between doing this right and doing it wrong is huge. There is one clear cue you can use to find the right muscle. When you feel that small lift at the base of the penis or between the scrotum and anus, you'll know you're doing it right. Doctors and studies back this up in simple terms. A randomized trial showed men who did pelvic floor training improved erectile scores compared to controls. Urologists commonly include pelvic floor training and rehab after prostate surgery. And clinicians report improvements in nighttime control and confidence. But the common thread in all the reports is this: the work has to be consistent and done in a relaxed, timed way. That's why the before bed habit matters so much. You've heard the problem. You now know the solution name. And you know the why. There is power in knowing this. But knowing is not the same as doing. Tonight, when you get into bed, you can start the habit. In the next section, I'll show the exact 5-minute routine. I'll give the counts, the posture, and the cues so you don't have to guess. If you want real change, the muscle, the timing, and the calm repetition are the 3 things to focus on. Now here's the part you've been waiting for. The exact 5-minute routine. Do this in bed tonight. It's quick. It's private. It may change things more than you expect. Lie on your back. Bend your knees. Keep feet flat on the mattress. Put one hand on your belly so you can feel your breath. Relax your jaw and shoulders. Breathe normal for a few seconds. Find the muscle first. Try stopping your pee midstream next time you're at the bathroom. That gentle squeeze is the same muscle you'll use in bed. Don't do that test often. Just use it to learn the feeling. The real cue in bed is a tiny lift at the base of the penis or between the scrotum and the anus. That lift is the target. Start with a 60-second warm-up. Inhale normally. As you exhale, gently squeeze and lift that muscle for 3 seconds. Think of it like an elevator going up one floor. Then relax for 3 seconds. Repeat this slow lift 10 times. Keep breathing. Don't hold your breath. If you tighten your butt, relax and try again. Now the corset. This is the heart of the 5 minutes. Do 3 rounds. Each round is 10 slow lifts with a 5-second hold. Squeeze and lift for 5 seconds. Then relax for 5 seconds. Count quietly in your head. Breathe in through the nose, out through the mouth. If 5 seconds feels too long at first, start with 3 and increase over a few weeks. After the slow holds, do 1 round of quick flicks. 10 quick squeezes. Each squeeze lasts 1 second. Release 1 second. Think of it like tapping a light switch rapidly. These quick contractions train speed and control. Finish with an endurance hold. Squeeze and lift and hold as long as you can without straining. Aim for 10 seconds. If you can't reach 10 yet, that's fine. Try 5 and build up. Relax slowly. Take 3 deep belly breaths to finish. That routine takes about 5 minutes. Do it nightly right before you go to sleep. Try to do it straight from the bed, not on the couch or standing in the kitchen. The timing matters. Night is when the body repairs. Night is when testosterone peaks. That's why this habit can be more effective than doing the same moves at random times during the day. You might be surprised how small mistakes ruin the effect. Here are the most common ones and how to avoid them. First, holding your breath. If you clench your chest or face, you're using the wrong muscles. Focus on breathing. Second, squeezing your butt or thighs. The move should feel local and light. Third, gripping your stomach. Keep the belly soft. Imagine the pelvic floor doing the job alone. Let me tell you about Tom. He's 67 and retired. He started this routine after noticing fewer morning erections and more trips to the bathroom at night. He did the 5 minutes every night. He kept a simple log on his phone. After 6 weeks, he told his wife he felt more confident. He didn't rush to a clinic. He told his doctor at his next visit. His urologist, Dr. Hayes, smiled and said the routine was exactly what many men need to rebuild control. Tom's story is one reason this habit sticks with men. It's small. It's private. It builds slowly, and that feels doable. Clinical evidence lines up with what men like Tom report. A randomized trial in a urology journal found pelvic floor training helped men improve erectile scores and reduce leakage. Urologists often recommend pelvic exercises after prostate procedures to speed recovery. Clinicians I've spoken with say consistency and relaxation are the keys. They're not selling anything. They simply want men to do the work the right way. What should you expect and when? Some men notice small changes in 2 to 4 weeks. Many see clear improvement in 6 to 12 weeks. Morning erections may return gradually. You may also notice fewer nighttime bathroom trips. Don't expect miracles overnight. This is steady work. It adds up. If you want to track progress, keep a simple journal. Each morning, note whether you had a morning erection. Note how many nights you did the 5-minute routine. Small wins matter. Seeing the pattern will keep you motivated when results are slow at first. If you want to progress after 8 weeks, add a standing set during the day. Do 2 rounds of 10 slow lifts standing after you brush your teeth. This challenges the muscle in a different position. Later, add gentle cardio like a 20-minute walk 3 times a week. Cardio helps blood flow and supports the pelvic work. But don't rush. Build the habit first. Safety is simple. If you feel pain, stop and check with your doctor. If you notice blood in the urine or sudden changes, see a clinician right away. For most men, this routine is safe and gentle. Now a few tips that make the 5 minutes more powerful. Visualize the lift like an elevator or a small hammock pulling upward. Use the bathroom test only to learn the feeling, not as a daily exercise. Keep your phone as a timer or use one of those gentle interval apps timed for short holds. Celebrate small gains. If you miss a night, don't panic. Start again the next night. Here's the emotional part. The feeling of control matters. Losing morning erections can make you feel older. It can hurt your confidence. But this habit offers something meaningful. It gives you back a sense of action. 5 minutes is a promise you make to yourself. It's a small act of care that matters more than many people realize. Now, the big reveal I hinted at. This is not about pills. It's about training a muscle you already have. Do 5 minutes of focused pelvic floor work each night. Do it with relaxed breathing and precise cues. Do it consistently. That combination may accelerate the return of morning erections and improve bladder control. For many men, that small habit is the turning point. Tonight, don't overthink. Lie down. Find the lift. Do the routine I just described. Start a simple log. If you're willing to do this for 8 weeks, you give yourself a real chance to change the pattern. In the next video, I'll show 2 bonus tricks that can multiply the effect. One is a breathing pattern that helps the muscle fire right during sleep. The other is a 6-week calendar you can follow. I'll also show a short standing progression that fits into a morning routine. If you want that, hit the subscribe button and turn on notifications. Try the 5-minute routine tonight and write a comment below about how it felt. Tell me if you could find the lift on your first try. Your story might help the next guy watching. Do this tonight. 5 minutes. One lift at a time. You've taken the first step. The rest is practice.